So on the website, if you go into supplements and blogs, we've got all the various supplements and blogs here. And let's go through them one by one. Let's first start with my anti-aging routine. Now, one of the main concepts around anti-aging is first understanding aging. So what happens as we age? As we age, we lose muscle mass, we gain fat mass, our joints become more arthritic, inflammation in the body increases due to a variety of reasons. And whatever you can do to counteract or reverse those things is what can be best described as anti-aging. And so you'll notice a lot of that kind of a trend. Also, we know that there are certain things in our body which start diminishing as we get older. So we lose collagen, which is the most abundant protein in our body. We lose hyaluronic acid, which you can describe as that jelly. When you have a filler, it contains hyaluronic acid. When our orthopedic surgeon injects a joint before a replacement, often it's a hyaluronic acid injection. If you suffer from dry eyes and you get artificial tears, often it'll be something like sodium hyaluronate. Again, so hyaluronic acid is a kind of substance, jelly-like substance, which is like a filler inside the body. And it's another thing which goes down as we age. And so what are the kind of supplements that I personally take myself? So I take a marine collagen. Currently, I'm on this VitaSave marine collagen because it's just better value. There we go. You last purchased it. I just bought it yesterday, actually, a new box. I was running out. And it's got 300 grams for $32. So it is slightly better value than the Organica one on there. Because this one is a bit more expensive. For 250 grams, you can see $35 for 250 grams. Of course, these are both Canadian companies. VitaSave and Organica, they're both British Columbia-based companies. If you have a look, we can see some studies here. For example, this was a study which looked at the effects of hydrolyzed collagen on skin aging. So systematic review and meta-analysis. This is a study which looked at the benefits of collagen peptides for improving bone density in postmenopausal women. And this is a study which looked at the benefits of collagen for symptoms of osteoarthritis. So there is scientific evidence there for a variety of things. The other thing I take in the morning is a capsule of hyaluronic acid. It just so happens that this is a Toronto-based company. Oh, there you go. Last purchased 7th of March. This is a Toronto-based company, Nutridom. And along with hyaluronic acid, it also contains vitamin C, which is a potent antioxidant. And here there's a scientific study which shows the benefits of hyaluronic acid for the skin. Now, the other thing you need to do is, particularly if you're talking about skin aging, is you want to reduce sun exposure. Sun damage accounts for 90% of skin wrinkling and aging. And the best way to do that is a combination of two sunscreens, a chemical sunscreen, as well as a mineral sunscreen. So like tinted mineral sunscreen on top. And so personally, I use this product called Eucerin. Nice, cheap sunscreen. It contains 5 antioxidants as well as hyaluronic acid. So I like it for that. But there are some other products that I've included there, which are also good, like this Vichy product. This one is a bit watery, so I didn't like it so much. The Eucerin was a bit more creamy, so it works kind of like a moisturizer as well. CeraVe is a good product. My children actually use it, which is why you can see I've purchased it a few times. And it contains niacinamide, which is vitamin B3, hyaluronic acid, ceramides, which are phospholipids within our skin, as well as SPF 30. That's a good product as well, and reasonably priced one at that. But I would combine a chemical sunscreen with a tinted mineral sunscreen. This is a good product here, but dermatology is also reasonably priced. And you can see it contains zinc oxide, which is a mineral, and it is tinted, so it contains iron oxide as well, hyaluronic acid, vitamin E, and niacinamide, vitamin B3. This is a good product there. The other one is actually almost identical, the L-MD, but it's more expensive. It's about $68. I'm not the biggest fan of the consistency of it. It's a bit irregular. But yeah, this is a well-known, reputable brand. And the third option is Eucerin. The problem with tinted sunscreens is that you really have to find the right tone for your skin because, they do leave a bit of white cast. So you do have to find the right tone for your skin color. Nighttime, I apply a retinol. This is one of my favorites, Marcel, because it contains not just, you can see I've bought this in September. It contains not just retinol, but also PHA, which is polyhydroxy acid, which is in this case mandelic acid, which is a mild exfoliant, and also contains something called bakuchiol. Bakuchiol is like a plant-based, it's a plant-based retinol type substance. So you can see this contains retinol, bakuchiol, as well as polyhydroxy acid. And it's quite cheap. I mean, it's not expensive. You can see it's quite reasonably priced, $25. That's what I apply at night. This one is also a good product, and technically it's slightly more superior because it does contain collagen peptides along with vitamin C and retinol. So that really is a good combination. And yeah, even the pictures look quite impressive on their advertising there. And there are a few other products that I have also listed, like this rock one, which if you look at what it contains retinol, which is vitamin A derivative, and along with that, sodium hyaluronate, which is hyaluronic acid, ascorbic acid, which is vitamin C. So yeah, and ascorbic acid, vitamin C is an antioxidant. Hyaluronic acid, of course, we know is a humectant. Humectant means something which will pull in water. So yeah, that's a decent and not expensive either, $37. And if you want to read about a scientific study about the benefits of retinol, here we have a nice scientific study which describes the benefits of retinol for reducing aging of skin. It's good to have a good moisturizer, and I have listed a few of my favorite moisturizers. For example, Cetaphil here also contains vitamin E, vitamin B5, niacinamide, hyaluronic acid. So a good combination of things for anti-aging purposes. This is CeraVe. Again, it's a staple brand. Again, contains hyaluronic acid, niacinamide. I would give it some extra points for containing peptides as well, along with ceramide. So CeraVe, definitely I would give you a few extra points there. $37. I mean, a bit more expensive than your standard moisturizer, but definitely has some good constituents. For those people who like oatmeal-based products like Aveeno, this is a decent product here, which contains some, they're calling it blackberry complex, which would essentially be vitamin C, because that's what blackberries contain. And let's see if there's anything else on there which is of interest. Yeah, mainly you could say vitamin C. There you go, vitamin C, vitamin E. So antioxidants with Aveeno. It's a good product for anti-aging purposes. I also use a red light device, which admittedly are a bit expensive, but the benefit of a red light device is that, multiple people in the family can use it. You just apply it for 10 minutes a day. And if you look at the pictures here, you can see quite significant improvements in signs of skin aging. And oh, there you go. You can see I'm not making it up. I bought that in November. So there you go. If you want to read some scientific studies, this shows the benefits of red light for wrinkles and fine lines. This is another study which again shows the benefits of photomodulation for reversing skin aging. And this is a third study which also shows the kind of wavelengths that you need to treat wrinkles. And that's why it's important to have a product which is licensed by Health Canada and FDA, because that ensures that they're using the correct kind of wavelengths. And if you go to the Candy-based store, you can see it's authorized by Health Canada as well as FDA. If you look over red light masks on Amazon, you'll find many of them, but I recommend this one because it is authorized, and that's the kind of thing you want to buy. But you could be spending a bit less, but wasting your money. It's better to spend a bit more and make sure it comes to good use. I also have this. There you go. I bought that on November as well. As you can see, rather expensive, $1,200 to preserve my hair. But if you want to have a look at the pictures, very effective. I mean, short of red light therapy, short of a hair transplant, using red light to stimulate hair follicles is really the most effective thing. And if you want to read scientific studies about how beneficial it is, you can have a look on the blog. All the studies are included there. That was one study. This is another study. If you have a particular problem with the baggy under eyes, then there is actually a product which contains hyaluronic acid, vitamin C, and pro-retinol for the under eyes. Almost a bit like makeup, really. This product is. It's not really. It gives you fairly quick results, and here you can have a read of a scientific study which looked at those kinds of products. I also use a certain serum twice a day, which is the Ordinary's multipeptide copper serum. It's blue in color. You can see I just recently bought that, and it contains copper peptides, so it's blue in color. Also contains collagen peptides. So this is a good formulation for anti-aging. Yeah. So and also contains hyaluronic acid. All right. Well, before we move to hair loss, I'm just gonna close a lot of these windows because now hair loss is kind of something which naturally happens as we get older, but there are things you can do. Minoxidil has really good evidence. And if you want to read a scientific study about minoxidil, then there is one here. This was for 5% minoxidil. Now, there used to be a situation where women were recommended 2% minoxidil and men were recommended 5% minoxidil. Now the consensus is everyone should just use 5% minoxidil, whether you're a male or a female. There are various types of formulations, but the good thing is even for women, it is now 5%. But if you're buying minoxidil or Rogaine, just make sure you're getting the 5%. Don't buy the 2%. Rosemary oil has actually been shown to be as effective as 2% minoxidil. So if you're looking for something a bit milder, there is some benefit of rosemary oil. Of course, I would say for people who have trouble with hair loss, they should probably do both. Use minoxidil once at night or something, and then use oil whenever you need it. The thing with minoxidil, though, is that you do have to wash your hands afterwards because any places you touch, parts of your body could end up with getting more hair growth. So after you use minoxidil Rogaine, you do have to wash your hands. This is the product for rosemary oil. It's a decent product. It's the same company. I also recommend the biotin and DHT blocking shampoo from here, which is a good product as well. But there you go, biotin and DHT blocking shampoo. And there is a study here which showed the benefits of this compounded formulation, which contained minoxidil, finasteride, biotin, caffeine, and some other mixes. Some nice pictures here. Now, of course, when you use a whole bunch of things, it's difficult to know which one actually had the best benefit. Biotin doesn't have the greatest scientific evidence, particularly oral biotin doesn't have very good scientific evidence. And unfortunately, that's actually what most people buy when they are having trouble with hair loss. And it can also interfere with thyroid function blood results. Oral biotin can. Ladies who are perimenopausal or menopausal may also get benefit if they're starting to get androgenic alopecia with soy isoflavonoids, which are like plant estrogens. And you have various different types of soy isoflavone products here. This one particularly is for hair, for weight loss. This one is for just with night sweats. And this one is for, again, mostly night sweats. The one I recommend to most ladies is the one for weight loss here. And this is a scientific study which shows the benefit of soy isoflavonoids for hair growth in mice. So yeah, there is some benefit. Right, let's move to a different blog now. Just gonna close these windows here. From here, I'm gonna just move on to, we're gonna stay on this topic, like the vanity topics, and then we'll move on to the metabolic topics later. So what are the best sunscreens to apply? I mean, summer is on its way. Very important to apply a good sunscreen. Like I had described before, we have 3 chemical sunscreens I recommend: Eucerin, Vichy, CeraVe, and then the 3 tinted, Elta-MD, Dermatology, and Eucerin. I recommend you apply one of each. Chemical at the bottom, tinted at the top. But there is a issue with sunscreens in that you don't want to apply large amounts of chemical sunscreen on your body, because at large doses for prolonged periods of time, there is risk of we call them hormone disrupting effects from these chemicals. And so for the body, I recommend a spray mineral sunscreen like this one. It will leave a white cast, You can see I recently bought this, but I would recommend a spray tinted sunscreen, which contains this one, zinc oxide is tinted. The two mineral sunscreens are zinc oxide and titanium dioxide. I would recommend something which does not contain all of these chemicals, if particularly if you're applying it on large parts of your skin, like without using a spray. Of course, I use collagen, I use hyaluronic acid, and the rest of it we've already discussed. This blog is just an extension of the nighttime retinol blog, which contains my Marcel, Paula's Choice, Rock, with a few other options if you want to explore those other options, and also includes my serum, red light therapy, collagen, hyaluronic acid, Rogaine, hair loss treatment, etc. I do have a specific blog on hair loss, which is similar to what we've already discussed: Rogaine, rosemary oil, biotin and DHT blocking shampoo, red light therapy. Just to cover all your micronutrients like zinc and others. Consider also consuming a daily multivitamin. If you don't have a water softener, consider just buying a water softener. It's like $50. You attach it to your shower head. You change the filter every 3 months or so. And it can also reduce hair loss for some people. And ladies with polycystic ovaries or menopause, perimenopause may want to consider a plant estrogen. And along with, you can see soy isoflavonoids have benefit for sugar. They also have benefit for your bones. They have benefit for polycystic ovaries. So loads of benefits. It's benefits for polycystic ovaries there. Benefits for bones. So yeah, soy isoflavonoids just have a lot of benefits. In the previous study, we looked at benefits for hair growth. So yeah, so many benefits. If you have specific hair problems like dandruff or psoriasis, there are more specific things that you can have as well for that. Of course, if you're iron deficient, that can be a cause, especially in women, of hair loss, and you may want to consider iron. There are treatment doses of iron, prevention doses of iron. If you take iron with vitamin C, then you will get better absorption of iron. And if you take it with fiber, then you're likely to get fewer side effects like constipation with iron. So, and generally speaking, if someone is deficient in iron, B12, D3, HDL is low, creatine is low, then it's possible you may have other micronutrient deficiencies that you haven't picked up on. So taking a good multivitamin, plus minus taking a good protein powder, which also contains vitamins, minerals, and probiotics, is probably a good call. Let's move on to our next blog. So I had made a specific blog for menopause and perimenopause, the kind of issues that women have. And again, you can contain plant phytoestrogens. You can consider collagen, hyaluronic acid, omega-3. Because we do know that lipids, cholesterol, all does reverse once you go through menopause. A good multivitamin, vitamin D with K2, protein, creatine, calcium with magnesium, good sunscreens, consider red light therapy, hair loss treatments. If you have dry eyes, then you can use something like this Hydrosense for dry eyes. You can see $11 here. And as I discussed before, it contains sodium hyaluronate. Everything contains hyaluronic acid. Remember, that's something we just lose as we get older, hyaluronic acid. And again, good moisturizer is also containing hyaluronic acid and that kind of stuff. I have a blog here for age-related degenerative conditions. And these things include things like degenerative disc disease, osteoarthritis, and what kind of things can improve that. Again, it comes back to what we were talking about. There are certain chemicals that we just lose as we get older, proteins and other substances, and you're just trying to replace them, whether it's marine collagen, hyaluronic acid, omega-3, a good multivitamin, vitamin K2 with D3, protein, creatine. And if you have certain specific conditions like dry eyes, dry skin, and for anti-aging purposes, there are a whole bunch of things that you could be doing. Great. I think we are done mostly. I'm just going to do 2 more blogs real quick. There's one for acne. So, adolescents or people who have acne, there's a whole acne routine and the best kinds of skin products for acne, including cleansers, face washes, azelaic acid, retinol, moisturizer, body wash, body soap, even face soap, non-comedogenic sunscreen, exfoliation, spot treatment. So anyone who's got acne can have a look at that blog. And I have a specific blog for antifungals as well. For people who have sweat rashes or dandruff or smelly feet, can consider all of these things, whether it's ketoconazole nizoral shampoo or Selsun selenium sulfide shampoo. Some people actually have to alternate these to get the best results. Antifungal cream for like a sweat rash, athlete's foot spray, and anti other kinds of powders and shampoos. That more or less covers all the vanity topics. Before we move to metabolism, I'm gonna quickly just go through respiratory, the blog, where we have a whole bunch of videos. We have a lot of advice on red flag signs, what things to look out for. A link to About Kids Health, which is Sick Kids Hospital website information. And these are the kind of products I tend to use when I get a common cold or anything like that for the first few days. Betadine product, which is antiseptic. My son recently had a cold, so yeah, you can see I purchased this recently, just a few weeks ago. Just once a day. It contains vitamin C, zinc, echinacea, ginger. You have sprays which also contain antiviral agents, cough syrups. And if you're someone who has allergies or chronic sinus issues, you could also consider like a Hydrocens Netirins or a Navage kind of system for your sinuses. Consider a humidifier, saltwater drops. These are all things you can consider. If you've had to have antibiotics, and particularly if you have metabolic problems and you're worried about the effect it'll have on your gut microbiome, there is a pro-antibiotic probiotic that you could consider, which has got some scientific evidence to back it up as well. But we have a separate probiotic blog, and there are a few other things here on here as well. Great. I think we can move to metabolic health, which is the topic I think that most people are interested in, to be fair. I'm going to just close some of these things here. So some of you would have had your CRP blood test done, and you would have noticed that CRP is raised chronically. And that's what we call chronic systemic inflammation. And I do have a whole video here on how to reduce chronic systemic inflammation. But there is certain supplements which may also help in reducing inflammation, including various types of fibers, insoluble fibers like this green banana flour, which you could add to a smoothie or even cook with, and soluble fiber like Metamucil here. So if you see this, here we have a study which shows how green resistant starch can reduce non-alcoholic fatty liver. It's an animal study. This is the study which shows how a Metamucil or fiber can relieve constipation, but also improve weight, sugar, and cholesterol in diabetics. This is a study which showed how psyllium husk or Metamucil improves body weight as well as sugar in diabetics. So these are randomized controlled trials. So these are good quality studies. And you can see they've been published in good journals like Nutrition. These are some probiotics which have been shown to help with weight loss through their effect on the gut microbiome. Of course, you probably want to take fiber as well, because fiber is prebiotic, which is what the probiotics feed off. So you can see here, this is a study which showed the benefit of this probiotic for weight loss here. And this study was published in the journal Lancet, again, reputable journal, and shows the benefit of this probiotic for weight loss. I would always take a probiotic with a prebiotic. What else the reason we're talking about weight loss is because probably the most common cause of chronic inflammation is excessive body weight, especially around the belly or truncal. What else can improve inflammation? Omega-3 is anti-inflammatory, and this is my favorite omega-3. You can see I recently bought this, and the reason I like it is because it's got a good dose, 3,000 milligrams compared to something from Costco. And it's got 120 pills. You only need to take one a day at that dose, so it'll last you 4 months. So it's good value for money. There is a vegan option as well. Certain multivitamins also contain anti-inflammatory agents, plant flavonoids or it's like lutein and lycopene, which have shown benefit for eye health and anti-cancer effects. You can see I recently bought this as well. And so, yeah, just a nice standard multivitamin. It also contains 1,000 units of vitamin D, which is quite impressive. So over the winter, I take extra vitamin D, but over the summer, I don't need any need to take extra vitamin D because this contains enough vitamin D. You've also got the 50 plus, and you've got the chewable versions of this as well. Certain probiotics have shown benefit for fatty liver. And this was a study published in the Hepatology Journal, which showed the benefit of this probiotic for fatty liver. And this is another high potency probiotic called Visbiome, which also showed some benefit for fatty liver, non-alcoholic fatty liver disease. I don't feel that consuming vitamin C and vitamin E is essential, because if you consume enough seeds and nuts, and personally, if I ever need snacks, I just eat seeds and nuts, then you should have very plenty of vitamin E. And if you're eating fresh fruits and vegetables, and my favorite snack is also fruit, oranges, tangerines. You should be getting enough vitamin C. But if you're going to track yourself on chronometer and find that you're not getting enough, or if you already have active liver, fatty liver, maybe stage 2 or 3, you may want to just not take any chances and take a supplement as well. And so this is a vitamin E. You'd be taking 800 units a day. And this is a vitamin C, which you will be taking about 1,000 milligrams per day of vitamin C. This was a study in which they took a cholesterol reducing medication and antioxidants like vitamin C and vitamin E, and showed a reversal of fatty liver after 4 years of using these. So there is some scientific evidence to back it up as well. In clients who are overweight and also have insulin resistance, pre-diabetes, they would definitely benefit from berberine, which is kind of a bit like metformin. It works on the similar kind of pathway, the cyclic AMP kinase pathway. And so berberine is something you could consider for that. And there's a study published in this journal here, which showed the benefits for weight loss with berberine. Again, if you have polycystic ovaries, consider soy isoflavonoids, which have benefit for diabetes, also for bones. Clients with osteopenia, osteoporosis should consider calcium citrate, which is better absorbed than calcium carbonate. Most of the common calciums, like caltrate, for example, contain carbonate, but citrate is better absorbed to the stomach. This one also contains magnesium. This is a scientific study which showed the benefits of that, a meta-analysis. If you're taking vitamin D, and particularly if you're 50 plus, definitely some benefit of combining it with vitamin K as well. And if you have osteoarthritis, then there is some benefit for other things. This is a study which looked at vitamin K supplementation and how it helped slow down bone loss. Of course, the difference between me and an Instagram influencer is that you can go to my blog and you can read all the scientific studies for yourself before you make a decision. Don't take any supplement just because I'm asking you to, I'm recommending it. Read the studies for yourself and make up your own mind. Osteoarthritis, you can consider collagen, and there is evidence for that, as we saw in this study here. For symptom control, you can consider hyaluronic acid. If you're losing muscle mass, you can consider protein powders. And there's benefit for the bones of consuming protein. There's also benefit for the muscles. Of course, it's two connected. Strong bones and strong muscles, they exist together. Creatine is something you can definitely consider. Again, I tend to always be between VitaSave and creatine. VitaSave is actually slightly more for better value. You can see I bought that quite recently. VitaSave tends to be best value, actually, even better than Costco. And this is a study which looks at the benefits for the bones. And this is a study which looks at the benefits for muscle. Creatine even has benefits for memory, it appears. And of course, if you are sedentary, then you need to exercise more. And particularly when it comes to supplements like protein, creatine, the maximum benefit you will get will be when you exercise. And here on this blog, I also describe various types of exercises, what their benefits are, how much you should be exercising. I've also even given you some splits, like if you're at the gym 3 days a week, this is the kind of split you can have. If you're going to the gym 6 days a week, you could have this kind of a split. How many sets you should be doing, how you should be dividing the sets, how many reps you should be doing. I've even given you examples of home routines, and I've also given you some examples of the kinds of exercises you could do and the kind of appliances you could be using to do these splits, whether it's upper body push or upper body pull, core exercises, lower body, cardio, increasing your non-exercise activity thermogenesis, so having a walking pad or having one of these elliptical devices. I think they changed the settings on here because I have I actually got this one myself. It's a really good one. For $165, you will be surprised how solid it is. It's very well made. I mean, you can stand on it and just keep doing your steps. Just by often, it's sitting in front of my television. If I'm watching TV, I just start using that. All right, let's move to the next topic. Close some of these windows here. So in that blog, we actually covered exercise blog as well, which is a separate blog up here. So we don't need to talk about that anymore. If you have fatty liver, are you interested in reversing that? There's a whole video on my YouTube channel, but the things which have shown benefit include omega-3, and here you can read a study of the benefit of omega-3 for reducing fatty liver. Fiber also reduces weight and sugar and liver fat, and there are some studies here showing how it benefits weight. And this particular resistant starch has specific benefits for fatty liver, non-alcoholic fatty liver, although this was an animal study. Certain probiotics have shown some benefit for fatty liver as well, like this one here and this one here as well. This study was actually published in the BMJ, the British